This is the Advanced Brain Podcast with third-generation neurotechnology pioneer, entrepreneur, best-selling author, music producer, keynote and TEDx speaker, Alex Doman. Improve your mental wellness as Alex sits down with the leading thought leaders of our time about how to optimize your brain, body, and life with the latest and most powerful tools to help you reach your unlimited potential. This episode was previously recorded and released as part of the Sound Brain Fitness series and is being re-released here in the Advanced Brain Podcast. Now, listen in and discover how to become the best version of yourself with Alex Doman.
Good evening. I'm your host, Alex Doman, calling in from Advanced Brain Technologies, where we've got a really beautiful fall evening here in Ogden, Utah. You can learn more about us and our work at advancedbrain.com. And now I'd like to tell you about my guest, Dan Cohen. Dan Cohen is the founder and executive director of Music and Memory, which is a nonprofit organization that promotes the use of personalized music to improve the lives of the elderly and infirm. The therapeutic outcomes of his work are portrayed in the documentary Alive Inside, which, as I shared, won the 2014 Sundance Audience Award. He has spent 20 years in technology companies, has served as a consultant and trainer for the U.S. Department of Education, and is an administrator of volunteer and community service programs for a consortium of 17 colleges and universities on Long Island. I should also mention that Dan is a social worker. So, Dan, I'm very pleased to have you join us this evening. Thank you so much for calling in.
Well, Alex, thank you so much for having me. I'm looking forward to it.
As am I. So I want to go back just a little bit to my first exposure to Dan and his work. There was a video clip of Alive Inside before it was released that went viral back in about 2012. And for those of you that haven't seen it, there's this beautiful elderly gentleman named Henry. And Henry hears the sounds of his favorite artist of his lifetime, Cab Calloway, through headphones. And you literally just see Henry awaken and come alive from being unresponsive. And, for me, it brought immediate tears of joy just to see the impact the music was having on him. And then I was so thrilled to see that the film came out at Sundance. I live in Utah, and the Sundance Film Festival is here in Park City, and I couldn't make the screening of that, but was very fortunate that my wife and I got to see it several weeks ago. And as soon as I had the opportunity to see the film and the other stories that unfolded, and as I understood Dan's greater vision and mission for the work that he's doing, I reached out to him, and he's been very, very thoughtful to spend an hour with us tonight. So, Dan, we all have songs that bring special memories to us. What gave you the idea to bring music to residents in nursing homes?
Well, so as you mentioned, I'm a social worker and I have a career in technology companies. And in 2006, I heard a journalist talking about how iPods were ubiquitous. They're everywhere. And I thought, well, all the kids have them, many of us adults, but in a nursing home. And if I'm ever in a nursing home, would I still have access to my favorite 60s music? And so I Googled keywords iPods and nursing homes. And even though in the U.S. there are 16,000 nursing homes, I couldn't find one that was using iPods for their residents. So I live on Long Island. I called up my nearest county 600-bed skilled nursing facility, and I said, I know music's already your number one activity. You have live music. You have a large activity staff. But can we see if there's any added value if we were to totally personalize the music? And I was told, sure, come on in. I brought in my laptop and some iPods, and it was just an instant and definitive hit with the residents. And so I'd come back every couple of weeks. I wouldn't just, okay, here's the music that you said or I think you like. I'd come back and we'd hone the list to get rid of the music that was just so-so, because we're all pretty much used to listening to whatever's playing on the radio or in stores or commercials on TV, and we don't really have tremendous choice, although we do now with digital music players. And so we really would hone the list every couple of weeks. So after 3 or 4 months, we had a list of 100, 200, 300 songs where every song was a song that resonated with that individual, either helping to engage them, connect with them, sort of bring them up, or help to calm them. And so that's the sort of how the beginning went.
Well, and from that beginning, amazing things have happened, and out of that, I know the nonprofit organization Music and Memory formed and grew out of that. Can you tell us a bit about what the vision and goals are for that organization?
There are some interesting statistics that have come out. So there are a couple of nursing homes in New York City that have done their own time and motion studies. These are studies never to be published because they're just not great. They say 90% on average of a resident's time is spent idle. And another statistic, which is generally recognized as being really conservative, is that half the people in nursing homes never, ever get a visitor. So if you're in a nursing home, no one's coming to visit you, and your time is spent idle, right, waiting for your next meal or your next medicine, that's really a recipe for decline, even if your physical status is pretty stable. And so go ahead. I went off course. What was the question again?
Well, what I was interested in is really what your vision and goals are for the Music and Memory organization.
So the goal is to bring this to everyone, really to make this a standard of care. There are, millions of people in the U.S. There are 1.6 million people in skilled nursing facilities, another million in assisted living, and we have probably 60,000 care facilities of different kinds in the U.S. So everybody should not lose access to their music. If people are home, they have, for the most part, access to their favorite music, and that shouldn't change when your home setting changes, just because you enter some other care organization, care facility. And so that's a very simple continuation of pleasure that pays off handsomely for not only the individuals that are living in these new settings, but also for the caregivers. And also the same applies for people who are at home, getting care at home, as well as for their caregivers. And that's really what's going on in Toronto, which I can get into whenever you want.
Great. So I'm interested. How much resistance or acceptance are you finding as new facilities are being approached? How do you get those doors opened? I know you opened door number 1, but now you've opened hundreds of doors. How is that going?
Well, it's going much better now. When I started, it was really difficult. That's sort of noted in the movie that facilities are just like any organization. They're institutions, and institutions, change does not come easily or quickly. But I think as people are becoming aware, whether through the Henry video, which is now past 10 million views, it's the most viewed video on dementia ever made, and now with the movie Alive Inside, it helps people understand. One of my frustrations initially was seeing these changes in people that were pretty significant. And when I tell my friends, remember, I'm doing this in the beginning for the first 18 months as a volunteer, and I tell my friends, well, you should really you should see what's happening here. This is really great. And they go, well, how nice, Dan, you're bringing the old people music. And I go, no, you don't really get it. We are really, I need to put this on film, get a filmmaker, just get a few minutes worth of film to show them directly, because we're all our own experts on music our whole lives. And for somebody to when I posed something a little different, it was tough to be accepted. So that's the purpose to me that the video clip and the movie now do. And those things help connect people to emotionally connect with what's going on here, so that they say, yeah, this is great. I understand it and I want to see it happen. And so that's really what the groundswell is now happening. We've hit that tipping point. And I think we'll have global acceptance once everybody sees the movie and sees the Henry video clip. And because there is no downside to this approach, this is something that's already going on in every facility, every program, every setting. There's music. But the problem is the music is for the group, so it's sort of for the lowest common denominator. And it's just like if any of your listeners were to think of their favorite genre of music, and then if you wrote down your top 5 musicians or groups or composers, and then ask someone that you know or someone you don't know, here's my favorite, tell them your favorite genre of music and have them try to guess your top 5 favorite musicians and such. Well, are they going to be able to guess all 5 or 4 or 3 or 2 or 1? And when I do this to a crowd, an audience, I'll get, of course, if I get a few people saying, yes, the other person guessed 1, we're lucky. And so right now, that's best practice in care facilities. We play music for the group. So certainly musicians are very adept and expert and at getting some of the people in the group to get going. They know what music to play, and it's that personal interaction, and live music is really irreplaceable. And so, but the secret guilt of musicians, they tell me, is that when they leave, their music leaves with them. And so the day is long, the week is long, and so people should not have to wait a week in time for that live musician to come back. And so we want to fill up that time with something else. And so to me, it's not really about music, live music versus recorded music. It's how do we have them complement each other to maximize the impact of both. And so that's very exciting. We're doing a lot around that interaction. So there's a lot of benefit here for everybody involved.
Right. So pragmatically speaking, the difference between live and recorded music is simply it's easier to provide everybody with an iPod and a pair of headphones than it is a music therapist or a harp therapist at their bedside. Working with them. But do you see any, and we have, by the way, a number of music therapists and harp therapists that are joining us for the call this evening. Do you see any benefits with live music that we don't accomplish with recorded music?
Well, I think it's very difficult if somebody wants to hear, Stairway to Heaven or something. It's tough to replicate that except the original music. And for someone with Alzheimer's disease, the song has to be, the very song by the very artist that somebody remembers from when they were young. I mean, that works best. But there are benefits. I mean, so I have one music therapist, and she used to play 2 hours a day for a group of 23 individuals with advanced dementia. And then the iPods came in, and she was responsible for them. So what she would do is set up the individualized music for each person. They listened for an hour to their headphones and to their iPods, and then for an hour after that, she went back and played her live music. She played guitar and sung to the residents. She says now with the iPods first and the live music after that, she gets a better reaction on her live music than she ever got from the residents. So, here's one example of tie them together. There's tremendous benefit here. And as music therapists tell me, this is helping them. They can only see 30 people in a week if they're spending an hour per person in a place with 100 or 150, 200 people. And this helps them extend and enhance their reach. I mean, we have probably 50 or 60 music therapists out of the 700 facilities of all kinds that are running music and memory programs, and they all love the benefits of this. I mean, every one of them is enhancing their craft and trying new things and integrating this to get more accomplished with those that they're helping.
Well, I'm really happy to hear that, Dan. Here at ABT, we produce recorded music that's used through headphones. So that's one reason why what you're doing resonated so much with me, is that we can touch so many more people. And how wonderful is it that others also have access to live music as well? They're just such a beautiful complement to each other. Now, I know from a number of the questions that were posed when people registered for the call, there's a lot of concern around Alzheimer's disease. We have 5 million Americans living with this form of dementia, and somebody's developing this disease every 67 seconds. I'm interested to know, as are our listeners, are you seeing any differences between less and more advanced stages of Alzheimer's in terms of response to music?
Well, the response, I think, is different at each stage. So music therapists tell me for early stages of the disease, this is really helpful to relax people. They're really getting upset and anxious. The middle stage is Mary Lou in the movie. Most people haven't seen it, but she's diagnosed with Alzheimer's disease, and she's got just great angst. and really uncomfortable with herself and living at home, getting great care from her family and such. But the more advanced, so 40% of those with Alzheimer's disease have more advanced forms of the disease, and the issue is that society views these individuals as being unable to experience pleasure. So why bother? I have physicians that say, well, there's no one home, so to speak. Drug them, doesn't matter. And it doesn't matter what you can do for them. In fact, you can't do anything for them, so it doesn't matter. And so, but we know that that's not the case. And we know that with music from their youth that holds personal meaning, we have a very good chance of reaching them, whereas all other approaches fail. And so that is really the massive win. Of course, this doesn't work with everybody, and it works with everybody in different people in a different way, but it does work most of the time, and it does work very well a great deal of the time. So when there is nothing else except drugs, which are just, the antipsychotics, which in the U.S. run about 20% of nursing home residents are on an antipsychotic, typically wrongly with antipsychotics. If you have a psychiatric diagnosis, well, that may be just fine, but unfortunately most people are on these drugs when they don't have any sort of psychiatric diagnosis, and just to keep them calm, and that's it's not good because you have these really pretty negative side effects, and you're taking away whatever character or personality that's left of them, and you're dulling them. And so the U.S. government is providing leadership in this area, asking all physicians and nursing homes and to cut back the use of antipsychotics. Last year was 15%, and then by the end of this year, 25%, and then by the end of 2016, 30%. And we're finding, though, I have a chief of psychiatry in the New York City Health and Hospitals Corporation, and they've been using this approach for 3 years, and they cut the use of antipsychotics from 38% to 13%. And we're getting this general kind of cut in half usage that you can very often substitute the music for the drugs, and why not? These are the sort of the main differences, sort of early, mid-stage, late stage of the disease. When a couple of years ago, someone came over from the UK to the United States, and she was a Churchill Fellow here in that capacity to come to the U.S. and identify the best programs in terms of fine arts and dementia care. And she spent 10 weeks in the U.S. She visited 40 different programs, including MoMA and Time Slips, all the programs that are model programs in the U.S. And she said, it's true, these programs are great. She says, but they're almost always focused on folks who are early to mid-stage in the disease, and that precious little is done for those who advance dementia. And the only way to reach these folks and to scale it to the numbers, because in the U.S. alone, if you have 5 million people, well, 40% is 2 million people who have advanced dementia, is through digital music, because we have to scale these things. It's not about that is the frustration. I just even on the American Music Therapy Association website, it says we're only reaching 1% of the people who can benefit. I would love to have music therapists in every senior care program, nursing home in the United States and beyond, but that's not the case now. Most are in working with children or in hospitals, and the number is relatively small. So we have to figure this out. We just can't wait indefinitely.
Well, it's a big challenge, but I'll tell you, something really stood out for me, in that you're telling me that you're seeing, on average, a 50% reduction in antipsychotics in the patients where these programs are being used. So I've got to think that an argument can be made for not only improved quality of life, but also a lower cost of healthcare delivery as being an argument for using personalized music in these facilities. Are you using that approach? Are you finding that to be true?
That is huge. Well, the state of Wisconsin actually just, they're gathering the numbers. They said, okay, so here are 50 people. They've been taken off, Seroquel, let's say, and if they were on 100 milligrams or 50 milligrams of Seroquel a day, and that would be $200 per month per person. That's a $10,000 per month savings, right? So,
that buys a lot of iPods, Stan.
So, yep, it will buy a lot of iPods. So the sort of return on investment and the money saved, but somebody's got to be the one. In the U.S., there is no limit. Doctors can prescribe the most expensive drugs, and there's no one who can say no. So the nursing homes, the doctors, they don't really have an incentive to reduce. To my knowledge, I mean, there may be some, but the federal government, which is paying the bill, somebody in there somewhere is, once they take a look at this and take it seriously in terms of, trying this on a large scale and tracking it. Well, we're hoping in Wisconsin, there are 1,500 residents with dementia who have iPods and across 100 nursing homes, and they're being tracked by the university against a control group of 1,500 residents with dementia without their iPods. And so the state pharmacist is tracking the decline. So both are declining over time in their antipsychotic use, the 100 nursing homes using the iPods versus the 300 in Wisconsin that are not. And the 100, the rate of use of antipsychotics is decreasing at a markedly faster rate than the nursing homes without. So because of that, and this is an 18-month study, they're looking at other things, quality of life issues and such, 18-month study that started January 1 of this year, and 6 months into the study, the Secretary of Health of the state of Wisconsin said the results are clear. We're funding another 150 nursing homes, another 1,500 residents with dementia. And our goal is to make personalized music available to every nursing home resident in every in the state, and then we'll do every assisted living facility, memory care unit in the state, and then we'll do every dementia care touch point in the state. So the goal is really for families, all of us with our own elders, is to get them. I mean, just like my father-in-law, he was fine, healthy, living at home. 5 years ago, he was set up. I set him up with his playlist, his iPod. He had headphones. He could play through speakers. And then he had a heart issue, and then he bounced around hospitals and nursing homes and hospice, and he passed. But the music followed him through the system. And that was really a major difference in how his life went, and how his mood went, and his behavior went, and his attitude went, and his caregivers, regardless of what facility he was in. And so that's what we want to see happen, so that people don't, what happens now, somebody's in a nursing home, they get highly agitated, they send them to the emergency room of the hospital sends them to the psych department pumps them up with one or more antipsychotics, the nursing home doesn't want them back, or they can't find a room in the hospital. I mean, so, and these people just are left, 70% of the people who go into, who have cognitive impairment, who enter a hospital, become delirious. I mean, so we have some real problems that the best hospitals, have a long way to go to properly take care of and attend to an individual's cognition so it doesn't rapidly decline. Then the person comes back. Well, they used to speak, be able to communicate. Now they come back, they can't. I mean, these are big issues where they never recover from that. And so that's a whole other area in terms of how hospitals handle and manage and pay attention to more than just the physical issue that caused somebody to be admitted.
Well, this, Dan, thank you for all that. This is a challenge that we all share in healthcare today. In America and frankly anywhere in the world where I travel and we do our work, we're faced as a society with a rapidly aging population, becoming the largest segment of our population. Inadequate facilities, insufficient care, because this is a problem that has just grown to a magnitude that I don't think any of us ever anticipated, especially with the rapid rate of increase in Alzheimer's and other dementias that we're witnessing. So, I think it's very exciting, the rapid adoption that you're seeing, and it really provides, I think, hope for all of us. But it's so important to think this is not just a problem for those that currently have somebody in their family, a loved one that has a dementia or is living in a nursing home. All of us, in some way, are affected, whether it's our tax dollar or it's our personal life. We've talked about many benefits: reduced anxiety, relaxation, decreased drug use. What other kind of general benefits are you seeing from those that have access to the Music and Memory program?
So this is not just about Alzheimer's disease. So when I was visiting a nursing home, sort of the lead one that started 3 years ago in Wisconsin, and I was talking to the administrator, and I said, so what's happening that I should know about, some feedback, what advice do you have for me? And she said, well, Dan, we have a whole floor of people who have psychiatric diagnoses, and we're finding the music is just as effective with them as it is with all of our residents who have advanced dementia. So there's this, and in the movie, of course, we have Denise, who's got bipolar schizophrenia, and that's and Gil, who's severely depressed, and so we just have these. It's good for everybody in a sense. I mean, and anxiety. I mean, anxiety is pretty rampant in the nursing home. Pain management, people using it for that. I mean, the Journal of Advanced Nursing. I don't know if that's the exact name. Maybe 7 or 8 years ago, out of the UK, they had a cover story on the front page, just how they've tracked their own reduction in the perception of pain with music, and so that really should be integrated into pain management approaches. I had a hospice that said, well, we gave this person their music, we cut their morphine drip by 75%. So that's another area. Rehab is a whole wild area. Occupational therapists, physical therapists don't know what to do. They tell me with people with dementia, because if the daughter says, can you help my mom keep walking? Well, your mom, she's not going to do the routine. She's not going to keep walking. She's not going to do what I say. She's got dementia. Don't bother. And so that's sort of a dead end. But with music, what the PTs and OTs and speech therapists are saying is they're accomplishing more. So they're able to maximize maximizing function in a way that they couldn't before. And that's just the way when all of us who exercise or know people that use music when they run or exercise, well, it helps us go further and do more and stay focused. And so why not apply that here? So there are all of these other ripples, dietary, for people. I've seen it over and over again. People that stopped eating, sort of failure to thrive kind of a situation, and just they hear some music that just sort of turns the key. It just puts them back on track, and they start eating or even feeding themselves if they stop for months, and then they gain weight, and then they live a little longer. I mean, so it's just been really interesting to watch how people react to music, especially in this sort of isolated environment of some sort of care organization where it's different.
Well, music certainly is great company. Yeah. I know in our work at ABT and with the listening program, we see many of the same things. That is music that's evidence-based and scientifically created to have different effects on the brain. And I think what I'm excited to hear is that personalized music, that right music that's already in us, also has very profound responses. Now, you've got a number of statewide initiatives. You've touched a bit on Wisconsin, and I'm particularly interested in Utah, which is, our home state where we're based, and we're very pleased that Deb Burkham, who is the Deputy Director of the Utah Healthcare Association, has just joined us. And Deb, are you here with us?
I'm here and thrilled to be invited. Thank you.
Well, thanks so much for taking time out. I know you're back in Washington right now, and we really appreciate you carving some time out this evening for us. And I know you've been working closely with Dan to reach those in our home state of Utah through the Music and Memory program. Can you tell us a bit about how you got started with that, what that spark of interest was, and where it's gone?
Well, like a lot of folks, I was lucky enough to see the documentary up at Sundance. And my husband is very much an introvert. I'm just the opposite, and we're watching it together. And at the end, when the director came in front of everyone for Q&A, I knew that I was going to do something, and I also knew that I had to connect with him. It was critical that I connect with him to find Dan. And so I just told my husband, I said, I need you to hold my purse. And I stood up in this crowded auditorium and I said my name, who I represent, the Utah Healthcare Association. I said, I will put this in every one of my nursing homes. And my husband said, well, everyone started clapping for you. I said, I didn't hear a word because I was so lasered in on the director. We found each other afterwards. He connected me to Dan. We spent an afternoon on the phone brainstorming. got my motivation. I approached our state survey agency, told them kind of my crazy idea. We decided we'd go after CMP money, so federal money within our pot at CMS. And we applied for the money, and within 90 days, we rolled it out to our members. And we actually had Dan come and join us, kind of as a surprise walk-on guest. And it has been nothing short of phenomenal, and I don't use that word lightly. Caregivers in hospitals, in nursing homes, if y'all have seen the film, you know what I'm talking about, is that these are the most wonderful, loving people in the world, and they're trying to do so much with so little. And this has given them this spark of now one more thing they can do to really, truly make their residents' lives more meaningful. And one thing that we're doing, again, in conjunction with Wisconsin, we're doing 2 research projects. One is to track the reduction in the use of antipsychotics, which is what y'all have been talking about. And the other phase of what I'm doing is to look at staff satisfaction, because I feel like once the residents are more engaged, the staff is going to be happier. Happier staff give better care. They stay in their positions longer, and I just think it's going to result, all in all, in better care for these residents.
Well, I think you bring up an important point, because so often, Deb, the caregiver is forgotten in this process. And, my mother-in-law was a cardiac nurse for many years, and then she went into hospice nursing. And after 2 years, she completely burned out. In that process. And I see this time and time again, and if we can improve the quality of care of the patient, we do so for the caregiver. And Dan, I'm also interested in, Deb, maybe you're seeing some of this here. Is there any experience with actually providing personal music to the caregivers that are caring for the residents?
Yes, certainly. In fact, I encourage caregivers to set up their own iPods so they go around and they're ready to go. There are nurses in one hospital in New York City with a large geriatric population, and the RNs have their iPod Nanos in their pocket with all of their patients' playlists on them. And so if they're going in and they're doing something that's going to be uncomfortable, wound care or give them a shot or something, they'll just put the music on the speaker and start playing it beforehand. Staff is using it to help themselves if residents are not so interested in becoming involved in group activities. So the life enrichment folks will start playing the music, give the music for this one individual who's kind of reclusive, and 20 minutes before the activity, then they'll come in, hey, you ready to go? Oh, sure, I'm ready. And so just change that, all these little changes which all add to just improved, more home-like day for people. Just people are more themselves, and they interact differently and better that way.
Dan, thank you. Yeah, Deb, please go ahead.
I was just going to say, for the families, too, for the families who come and visit their loved ones in a nursing home, how wonderful would it be to have mom back? For whatever period of time you get, that it's going to just enhance the family engagement and involvement in these people's lives. If the person is more engaged in today, then what wonderful, beautiful incentive is that? And I have another bit of good news that Dan doesn't even know yet. I was approached last week from one of the large high schools in the Salt Lake area, and their senior class wants to adopt this initiative as their senior project for this year. And, that involves fundraising, but more than that, it involves engagement from these bright, dynamic kids that want to get involved in this project. So I'm quite excited about that.
This is really, this is so great if I can, Alex. What Deb is doing, first of all, Deb has really been the spark behind so much of what's going on in Utah and bringing everybody along and on board, and she's just gotten unbelievable support. This whole, once the nursing homes are up and running, this concept of student involvement. When people become older, by natural attrition, their friends and family are dying or they move away, and you have less and less. And then when you move to a nursing home, that kind of accelerates the process because family and friends that are left are less likely to want to visit. They're nervous about going to a nursing home, seeing people with Alzheimer's. But once you have the students coming in using music to break the ice, so here you have, a kid with somebody several generations older, maybe a different culture, and that's kind of scary. But when the music is in common, the kids come in with the sort of tech confidence that they know this stuff, and this is the perfect storm of intergenerational activity, as it's been described to me by one faculty advisor of a National Honor Society at a high school, where they visit every week a local nursing home to visit the residents with Alzheimer's. So this is huge, both for the students who are sort of, these days with all that screen time young people have, and there's less and less interaction with their elders. This is going to help break down those barriers and facilitate that. And what's so nice about it, it's not just for the elder, it's really a win for both. And students, I found, they often think it's the best thing they ever did because they help to change a life in a way that is clear and immediate. And there aren't many ways you can do that these days. So it's pretty huge.
Well, it's an incredible generational bridge builder, certainly. Now, Deb, what has been the level of penetration in the state of Utah? Can you share with us how many nursing homes we have here and how many
Sure.
are doing the personalized music programs?
Well, we have 100 nursing homes in Utah, and so far we've gotten 70 of them certified. And so that means they've gone through one-on-one webinar training with Dan. And we are, I think now 26, 27 of them actually have their equipment and they're rolling through it. The delay in the others is getting them through those initial research projects, because I'm not going to lie to you, I don't lie to them. It's a pretty comprehensive analysis on the front end, but we go through it because I said we want to be able to give quantifiable data results to show improvement, because this is one of my goals. Another one of my goals is that CMS is going to start paying for this. I am just committed that we are going to have enough data that they are not going to be able to not fund this program moving forward. So that's an ultimate goal for me.
So, Deb, for those that aren't familiar with that acronym, what does CMS stand for?
Oh, I'm sorry. It would be Centers for Medicare and Medicaid Services. So essentially the public funding, whether it's Medicaid or Medicare. And those are the big government payers.
Right. So that's who we have to really get the attention of.
But you know what? We're getting their attention. We had our regional and the Western, both the Denver regional office and then the people from the Western Consortium. So the office that's over the whole western part of the United States, they were out at Utah Healthcare Association's convention, 2 weeks ago, to see the film, to meet Dan, and to watch the training that we're doing for our members, and to hear from the gentleman from Wisconsin who was giving data showing results of the progress they're already making. So, I'm doing my best to involve them at every turn of the dial, if you will.
Oh, that's exciting. I'm interested. You made this happen very quickly, and that is not typical for others that are listening across the U.S. Do you have any tips for somebody that wants to spearhead this initiative?
You know what? As I promised Dan on the front end of this, I am happy to be a resource to anyone, and I will share this. I'm in D.C. right now to the American Healthcare Association National Convention, and I'm speaking on this program tomorrow morning for leadership here. I've already spoken with 2 committees that I sit on, one on Saturday, one today, and have showed the film to them. I said, we're doing this. We as a profession are doing this. I said, you can either come with me or I'll come back and drag you later, but you're going to do this with me. We're doing it for the right reason, for the resident.
Well, I take it you don't take no for an answer.
I don't.
So, Dan, this question's for you. I know when I was doing the research for my book, Healing at the Speed of Sound with Don Campbell, we did a lot of research on music and aging, and it was one of the book chapters called The Melody Lingers. We found a breadth of information supporting the use of music with the elderly. What recent evidence have you found that really supports using music with the aging that has you most excited?
What aspect is most exciting? I think I'm most moved by people still being themselves as long as possible. So when somebody hears the music and they're really bedbound, not responsive, and then the music comes on that's familiar and that foot starts going to the music, or they start humming or singing the song when there was no communication at all, I mean, that's huge. The folks in hospice love this. Okay, so it is. They're just getting all of these great reactions to the music. They're even sort of surprised, I think, to some extent. They in hospice care they shoot for comfort, but now with the music they shoot for joy, which is nice. So for me, it's a combination of things. It's just keeping people with us as long as possible, and feeling good about themselves. And helping to facilitate that, life is all about our interactions with others. Life is not very good if we're not interacting and talking and feeling at home and people care and they're paying attention and they're not just whizzing by us. And so, I think everything about this really speaks to the best part of what great nursing home care and home care, all of this applies to home care as well. People living at home and getting care maybe from aides and nurses and social workers in any setting. And also that home care aspect of it, the music, because so many people are families, they may have promised their parent, I'll never send you to a nursing home. But then one day, Mom, sorry, I have to send you to, out because I can't manage you here. We need somebody who can do this better. And so if the person at home is less agitated because they're listening to the music, then they're able to stay home longer, maybe much longer. And that's another very exciting piece. When you talk about the money saved, well, of course, the government and everybody knows that if you double the number of care facilities of any kind anywhere, well, that's a big puts a hole in any country's budget. And so if we can sort of manage that a little bit, I think this is probably one of the easiest, least expensive tools to make a measurable impact on that.
Yeah, no
and Alex,
question.
If I can jump in, what we're doing in Utah is a little bit of an expansion on what Dan has done so far. Is we have 15 facilities that care for individuals with intellectual disabilities, including autism. And while I couldn't fund the program the same way through that same pot of money that I got for my typical traditional nursing homes, I have just about reached the amount that I need to fund this program and put it in these facilities for the people with intellectual disabilities. So we're excited that it's going to have this, maybe a similar benefit to maybe some of the mental health issues. It can help decompress some behaviors, help individuals possibly with autism reconnect, find some peace, let this be a bridge between where they are and people who love them. So that's something that we're going to be doing over the next couple of months.
Well, that's very exciting, and that is a population that we have extensive experience with. We work with several thousand practitioners worldwide, and that's largely the population that they're serving. And it is miraculous, the same kind of responses that Dan, you're seeing in the nursing homes with the elders we're seeing with this population. So I'm excited to see that come here to Utah, Deb.
Perfect.
Now, Deb, you mentioned something, and I want to follow up on that because we do have a number of these healthcare professionals listening now. Dan, I understand that there is a music and memory certification program. Could you maybe provide a quick synopsis of just exactly what that is?
Sure. When I started this, I thought, well, this is iPods and iTunes, and anybody can do this anywhere. every nursing home has people who are proficient with all this. But what happened was when they'd start, and they do, rolling out 1, 2, 3, 4, 5 iPods, and it's working, then they kind of hit a number of administrative concerns, which slows down any adoption that can scale. And those concerns revolve around, number one, the legalities of the music. Is it legal to be doing this? Number two, the iPods are going to get stolen, and they'll get lost, and we have enough problems with hearing aids and dentures. And number three, that staff has no time for this. They're busy enough, and it's going to be a drain on time, so they can't get going. So the webinars are really all about how to successfully integrate this approach into the flow and the structure of any care facility in a successful way. So we've done this in 700 settings. So that's skilled facilities, assisted living facilities, adult daycare, hospice, home care, hospital. Really, every kind of healthcare setting has tried this. And so what that means is I provide 3 90-minute sessions over 3 days, once a month, and during that 4.5 hours of time, I really share just the many little tips and approaches, and how do you store these things? Who's charging them? How does it look in a care plan? I mean, how do we involve the community? What works? What doesn't? How do we get donated iPods because we don't have the budget for this? So it's all those kinds of things. Plus, we provide just a boatload of materials and forms and tools and marketing materials to help people get started, so they don't policies and procedures, so they don't have to reinvent the wheel. And then over time, Music and Memory supports all of these organizations and develops a community, sort of a sharing community. So I'm a big sharer, so as people build on this model, we share it back, and then it goes out to everybody again. And that's the goal and intent.
Oh, wonderful. Dan, I'm wondering when you sleep.
Well, that's been a challenge. I'm doing my best. I'm trying to leverage technology, which is the best I can.
Well, you're obviously leading the cause here, and I imagine that you've got a great brain trust surrounding you, supporting you in this work.
Well, with people like Deb, I can't go wrong, period. Deb is making it happen. Deb
Clearly.
Is a superstar. Deb is a superstar in my book.
No.
Clearly.
You know what? Truly, you are a hero for so many of us. We've been looking for something to get involved with our hearts and our backs, and this was perfect. So thank you.
A lot of people, and myself included, and I've got some thoughts on how we can help the work that you're doing, and steps we'll take to contribute. But what's the best way for our listeners to help and get involved?
Well, there are a number of ways. I mean, I like to say start with your family, your own elders, yourself. Get that playlist going for yourself and the people close to you, and sort of be a model for playlists for others. And then make sure your family members, you get that set up for them regardless of this, whether they're healthy or not. Let them start enjoying that music. Put that list together now when they're able to articulate it. So later on, if something happens down the road, it won't be a struggle trying to figure it out. That's number one. Number two, help in the community. Help. Suggest this to a local care facility or ones that you're associated with and working in. Show them the Henry video clip. Start from there. Look at the Music and Memory website. There's just a lot of materials. There's a free PDF, several to download. One's how to create a personalized playlist for your loved one. And another one's how do you run an iPod donation drive. And another one how to initiate this in a nursing home. You can encourage community groups to adopt a nursing home, just the way Deb talked about the Salt Lake City High School that wants to adopt this program as a class project. I mean, that's huge. So it's unusual, when we think about asking people in the community for money, we sort of cringe a little bit, but this is a different kind of ask. This is a one-time ask with immediate results where the bang for the buck is more than just about anything else you can do. So I have a number of foundations around the country that have said, here's $30,000, start 10 nursing homes going in our city or in our religion or whatever. And so that's just another way to kick that off. You know, many of you have connections or getting religious groups involved or local corporations. In Salt Lake City, Skull Candy has been great. They saw the movie, they got excited, and now they're involved on a number of levels in Utah and helping to facilitate Deb's work and what we're trying to do at Music and Memory. And everybody has corporations that are ready to help. And go to Music and Memory website. If you know people that want to donate, click on donate, and whatever we get centrally, the cash that we get goes back in the form of startup kits and new iPods for new nonprofit nursing homes. So those, and if there are other ways people want to help them, and they can volunteer. There's when students want to volunteer, or sometimes your own. For those in the audience, your children, your grandchildren, and have them run that iPod drive in school. Have them go in, not just run the iPod drive, then go in, help the nursing home set up the iTunes library, load all of the music, learn the personal preferences of the residents, and then spend time. It's sort of a friendly visiting with music, face to face, maybe with a headphone splitter, two headphones coming out of one iPod. These are just amazing things people can do.
So, Dan, you are creating an amazing legacy of many lives touched. Is there one life, one experience that really stands out for you since you started this back in 2006 that you'd like to share?
I guess the most striking, when I first started this, I'd say, who's your most disruptive resident in a nursing home? And so, we have one nursing home said, Cobble Hill in Brooklyn, and this guy would be cursing at the staff and taking his arm and knocking out whatever drink, water, food. It was just really a big problem for everybody. And let's figure out, well, what music does he like? What is this? Does he have family? Because he's not able to articulate. He had Alzheimer's, and there's no family around. But they knew he was a veteran, and so we made up a patriotic playlist. The guy snapped to attention and started humming to the music, and the agitated behaviors ended right there. And so as long as that music was playing, he was a kitten. But that's all it took. And so after 6 months of this, he said, and this is a guy who was not able to articulate, he said, I used to watch John Wayne movies with my dad. And so then they alternated between the John Wayne movies and the patriotic music. So to me, that was sort of, when I started this and I didn't know quite how effective this could be, that really sort of hit it home to me that this kind of potential was there.
Well, that's powerful. That's really powerful, Dan. Thank you so much for sharing that story. And Deb, I imagine you've had some opportunity to come in contact with some individual residents in Utah. Is there any one that stands out for you?
Well, I haven't been able to get out there since they've been rolling it out, because I've been involved with my own big event. But I can assure you, when I get back from this meeting next week, that's the first thing I'm going to be doing, is out in our facilities and getting to meet our own Henrys, Utah's version of Henry. And I'd love to follow up with you on a later program and share our stories. We'd love that, because it really comes down to those individual lives being touched. Ultimately, we talk about scalability and reaching so many, but it really is one person at a time that this is happening. We've got a couple minutes for Q&A, so what I'd like to do is open this up for any questions that our listeners may have. If somebody has a question either for Dan or Deb, you can ask that question by first hitting *7 on your phone, and if you hit *7, that will unmute you, and then you can go ahead and ask your question of Dan or Deb. So I see that Kathy, you're on the line with us. What's your question this evening?
Hi, I am so excited by this. I've been doing music with people for so long. I've been 20 years artist in residence with Shands Arts and Medicine, and I'm a heart therapist with the International Heart Therapy Program. And I got into the working with the older folks because of my own mother and her, this happens with so many of us, her own battle with dementia and Alzheimer's, and I started playing music. And even just doing live music with people, I tell people, just bring music in that's their favorite music, that's recorded, because it'll change their hospital experience so much. Here they are in this horrible, unfamiliar setting. They're going through some kind of trauma, and the people who are their family and caregivers are dealing with so much. They don't even think about that, right? So what I love about this is that you're making people think about it, because I've been wanting to tell. I love what you just said. Begin with your own family. That's so much what I see, and what is such an easy thing to do. But also, I'm in these several different conferences coming up, and I'm wondering about how one can get the movie. I know that it's kind of only available as a limited release, but I'd like to get it for the Arts and Healthcare Conference coming up. I'd like to get it for the National Center for Creative Aging Conference coming up. What do we do? How can we get Alive Inside?
Dan, how do we get access to the film beyond local screenings at this point?
Sure. So the local screenings of the theatrical run is really over for the most part, but it is available for licensing for just those kinds of groups, conferences and such. And if you go to the Alive Inside website, which is aliveinside.us, on there you can say, I would like to, get a price of what it would cost to sort of rent the film, essentially, and show it. And the pricing ranges based on the size of the group and the type of group and all that, whatever sort of market standard pricing, would apply for this kind of thing. But yes, you can have it. You could build a whole event around it. You could build a fundraiser around it. You can just make have a panel afterwards, have somebody who's running a music and memory program part of that panel, because the questions after the movie are not necessarily all about the neuroscience, because there are neuroscientists in the movie, so the audience gets a good dose of the science and such. But many people have questions that are just sort of nuts and bolts questions. What happens when you put headphones on a person with dementia? What if they knock it off? So those kinds of questions that you only know if you're doing this.
I think it'd be great to have a whole event at the conference that was built around this and that incorporated live music and various other issues that you're talking about into it.
Absolutely, sounds great. I mean, people are doing this, and it does. The film is great from the point of view of people don't get out of the seats. People are not in a rush to leave. They see the movie, and they are truly sort of mesmerized in a sense. I mean, it's one of those movies that people are still thinking about their favorite character in the movie. A week, a month, or months later. Or it's a kind of movie with somebody would see it on a Friday night, and they'd return with their friend or relative on Saturday night. You got to see this. But it's going to be on Netflix October 18th. At least that's what I'm hearing. I've always been wrong on whatever dates I give, so that's sort of the latest with that in mind. And then November it'll be available on DVD and iTunes and such.
The other thing that I wanted to mention that was so interesting was that the phrase "Alive Inside." I just watched Awakenings again for the first time right after Robin Williams died. I just had happened to pick up the movie a day or two before he died, and when I watched it, that was the phrase he used when he was trying to explain to the doctors that these people were still there. He said, they're alive inside, and I was so excited when I saw that.
Oh, that's great. I really forgot about that. It's been a long time since I've seen the movie, so now I have to see it again.
I know, all the way back to that early Oliver Sacks book.
Kathy, thank you very much for your question and your comments, and
thank you.
We look forward to seeing what you do with this work.
Thank you.
Have a good evening.
Too.
Okay, so believe it or not, we're reaching the close of this hour, and I think we could spend many hours. People have such a great interest, and I believe we are able to address many of the questions that our callers asked. And I just want to encourage those listening. You want to get involved and you want to learn more. Go to musicandmemory.org. That is the website for Dan's Music and Memory organization. And to find a local screening of Alive Inside, if they are still running, and more information on the film, you can do so at aliveinside.us. So I do want to thank everyone for listening. Please visit advancedbrain.com for more information on what you just heard, to listen to other shows and subscribe to the Listening Program Radio podcast. You're also going to be able to access the recording of tonight's call there within the next 24 hours. So we invite you to listen again, to share the podcast with your friends and family, or they can just simply listen on our website if they don't use podcasting on iTunes. And you can learn more about our work by also phoning us at 801-622-5676. So in closing, I'd like to leave you all with a quote from Charles Darwin that we found in his autobiography. And it's, "If I had my life to live over again, I would have made it a rule to listen to some music at least once every week, for perhaps the parts of my brain not atrophied would thus have been kept active through use." And I think that's a very wise reflection. We all have that opportunity to keep our brains sharp, to stay connected, to live happy, healthy, productive lives, and music is certainly one of the tools that can help us stave off the ravages of dementia and just enjoy a long, healthy life. So I want to thank you all for listening, and once again, Dan and Deb, thank you very much for joining us this evening.
My pleasure.
Well, thank you so much.
Okay. Be well, everyone.
Thank you for listening to the Advanced Brain podcast with best-selling author, keynote speaker, and founder of Advanced Brain Technologies, Alex Doman. In the show notes, you can find links to all the resources mentioned in this episode. Please subscribe to the podcast from whichever platform you might be listening in. Of course, it's free to subscribe, and it ensures that every time we post a new episode, you'll find it right there waiting for you to listen to in your podcast app of choice. And for more information regarding the world's most innovative neuroscience-based music programs for optimal human performance, please visit advancedbrain.com.